Hello everyone and welcome back to my YouTube channel. So if you are new here, so don't forget to subscribe and hit the bell icon for more updates on all things which are related to medical entrance exams. So today we are going to talk about a very crucial subject for AIAPGET 2024 aspirants, that is obstetrics. So in this video we will cover important topics, key questions and essential points that you need to focus on while preparing for this MD examination. So let's dive in. So let me tell you very clearly that obstetrics is a major subject in AIA PGET exam, and it's essential for future practitioners as it deals with the pregnancy, childbirth and postpartum care. And mastery of this subject is not only crucial for your exam, but it is also for your clinical practice. So let's talk about this. Important topics, key questions and essential points which you need to focus while preparing for this exam. So let's start. Topic we have is menstrual cycle. So if we talk about the menstrual cycle, it has four phases. That is menstrual or bleeding phase. This is the first phase. Second is the proliferative phase. Then third is the ovulatory phase. And last one is secretory phase. Now, one by one, I will be explaining each and every phase in an elaborated manner. Okay, so first phase we have is menstrual or bleeding phase. So this phase lasts for about 1 to 5 days. And in this phase, the post-menstrual endometrium thickness is 1 mm. And second phase is proliferative phase. So this phase lasts for about 6 to 13 days. And in this phase, what happens? Ovarian follicles grows. They grows under the influence of estrogen. Now third phase is ovulatory phase, and this is very important. And this phase lasts for about 14 days. And what happened during this phase? There is LH secretion, and it peaks 12 hours before the ovulation. And there is LH surge also, which precedes ovulation by 36 hours. And the last phase of menstrual cycle is secretory phase, and this phase lasts for about 15 to 28 days. Now, what happened during this phase? In this phase, corpus luteum forms and is regulated by progesterone, which is produced by it. So what you have to remember in the four phases of menstrual cycle, so you have to remember the days of all the phases. Okay, and the most important one is the ovulatory phase, so you should have a thorough knowledge about it. Now next, now some important key points, so let's talk about it. So recruitment of the follicles is done by follicle stimulating hormone, and rupture of the follicles is done by luteinizing hormone. And ovulation depends on two hormones, that is FSH and LH, that is follicle stimulating hormone and luteinizing hormone. And maintenance of the corpus luteum is done by progesterone. And if we talk about the maintenance of corpus luteum in pregnancy, so it is done by HCG. So these are some important key points which you should remember. Now we'll study about the hormones one by one. So we'll talk about corpus luteum, estrogen, and HCG. So first we have is corpus luteum. So as we all know that luteinizing hormone is responsible for the initiation or formation of corpus luteum, and maximum activity of the corpus luteum is on the 8th day and the 23rd day of the menstrual cycle, and this is very important. And this hormone, that is corpus luteum, it secretes relaxin, inhibin, progesterone, estrogen. Okay, so remember this. It secretes relaxin, inhibin, progesterone, estrogen. And it also secretes progesterone. And if we talk about the progesterone, so progesterone maintains normal pregnancy, and you all know very well this. So this was all about the corpus luteum. So in corpus luteum, what you have to remember, that is, you have to remember the maximum activity of the corpus luteum is on the 8th day and the 23rd day of the menstrual cycle. And corpus luteum secretes relaxin, inhibin, progesterone, and estrogen, that is ripened one. Okay. Now second we have is estrogen. So if we talk about the estrogen, so it is secreted by the granulosa cells of the ovarian follicles, and it is also secreted by corpus luteum. So what happened in the late pregnancy? It is secreted by placental syncytiotropoblast. This is important here. You have to remember this. In the late pregnancy, it is secreted by placental syncytiotropoblast. Now we have three features here, that is estradiol, estriol, and esterine. So estradiol is present in normal people, estriol is present in pregnant women, and esterine is present in postmenopausal women. So remember this: estradiol, estriol, and esterine. And estrogen inhibit the prolactin, and the conditions along with a low estrogen in blood, this is present in menopause and lactation period. So what you have to remember from estrogen: firstly, you have to remember this: in late pregnancy it is secreted by placental syncytiotropoblast, and it is naturally occurring in estradiol, that is in normal people, estriol in pregnancy, and third is estrone, that is in postmenopausal women. These are the three forms of estrogen. And next you have to remember estrogen inhibit prolactin. And next is what are the condition along with there is a low estrogen in the blood. So it is present in menopause and in lactation period. Next we have is HCG. So HCG is basically a glycoprotein, and this is a very important point, that HCG is a glycoprotein hormone. And if we talk about the half-life of HCG, so it is 24 hours, and this is very important. And HCG is synthesized by syncytiotropoblast of the placenta. Again, very important line, that is HCG is synthesized by syncytiotropoblast of placenta. And in maternal plasma, its level starts rising on 8th day after ovulation, and peak level is seen around 10th peak. Okay, next, very important, it disappears from the urine after 2 days and from blood after 2 weeks of delivery. And HCG has luteinizing hormone-like action, that it stimulates progesterone production by corpus luteum. This is again very important. Okay, so in HCG you have to remember it is a glycoprotein hormone. It is synthesized by syncytiotropoblast of the placenta, and it disappears from the urine after 2 days and from the blood after 2 weeks of the delivery. And HCG has a LH-like action, that it stimulates progesterone production by corpus luteum. Now next I will talk about what are the conditions or what are the conditions where HCG level is high, and what are the conditions where HCG level is low, and similar with the progesterone. So first, high level of HCG, or simply HCG increased, is present in Down syndrome, twin pregnancy, and molar pregnancy. This is very important. Next, what are the conditions where HCG is low? So HCG is low in ectopic pregnancy and in abortions. Okay, this is very important. Next, if we talk about the progesterone, so what are the conditions where progesterone is decreased or increased? So first, it's decreased in ectopic pregnancy and abortion, and progesterone is increased in hydrated mole and Rh isoimmunization. Okay, next we will talk about the estrogen. So estrogen is decreased in hydrated mole, fetal death, and Down syndrome. So these are the very important point. You should learn them. Okay, they are very important for the examination. Now next we'll talk about the antenatal ultrasonography, and this is a quite important topic. So listen it very carefully and try to learn it. So if we talk about the antenatal ultrasonography, so it gives best predictive value in the first trimester, and for the determination of the gestational age in the first trimester, CRL, that is crown rump length, is used. And for the determination of gestational age in second and third trimester, BPD is used up to 28 weeks. And femoral length is more reliable parameter in later gestation periods. And abdominal circumference is the single most best USG parameter for IUGR, that is intrauterine growth retardation rate. Okay. Now next we'll talk about the first trimester, second trimester, and third trimester, and the abnormalities and some signs which you have to remember. So as we all know that first trimester lasts up to first 12 weeks, second trimester for 13 to 28 weeks, and third trimester up to 29 to 40 weeks. Remember these, okay? First 12 week is first trimester, 13 to 28 week is second trimester, 29 to 40 weeks is third trimester. Let's talk about first trimester now. Already said first trimester lasts up to 12 weeks. So we have certain signs during first trimester up to 12 weeks, which you have to remember. So first sign we have is Jacquemuir sign, or you can say Chadwick sign. Now what is Jacquemuir's or Chadwick sign? So in this sign there is a dusky hues of the vestibule and anterior vaginal wall due to the local vascular congestion. And this sign appears on the 8th week of the pregnancy in the pelvic tumors like fibroids. Now, second sign is Osiander sign in the first trimester. Now, what is Osiander sign? So, Osiander sign means increased pulsation which is felt through the lateral fornices. And this sign appears at the 8th week of the pregnancy and in acute pelvic inflammatory diseases, that is PID. Next sign in the first trimester is Goodell sign. Goodell sign means softening of the cervix. This sign occurs at the 6th week of the pregnancy and in OC Bill's users. The next sign is Haggard sign. So what happened during Haggard sign? So on bimanual examination with two fingers in the anterior fornix and fingers of other hand behind the uterus, the abdominal and the vaginal fingers, they seems to oppose below the body of the uterus, and it occurs because of the softening of the isthmus. And this sign occurred at the 6 to 10th week of the pregnancy. The last sign of first trimester is Palmer sign. Palmer sign means regular and rhythmic uterine contractions, which can be felt on bimanual examination. And this sign can be seen on 4th to 8th week of the pregnancy. These all signs are very important. You should learn them by heart. And remember the beaks especially and their definitions. Second is second trimester. So in second trimester, important we have is quickening. Quickening means perception of the active fetal movements, and active fetal movements are felt by 18th week of the pregnancy in primipara and in 2 weeks earlier in multipara. And there is a progressive enlargement of the lower abdomen by the growing uterus. Okay, so this was all about the second trimester. Now, third trimester. So, what happened during third trimester? There is an enlargement of the abdomen, and it is progressive, which produce some mechanical discomfort to the patient, such as palpitations or dyspnea. And some important things which you can observe in third trimester are, that is lightening. See, remember it very carefully. In second trimester we have quickening, and third trimester we have lightening. Don't get confused with it. So let's talk about lightening. So it is seen at after 36 weeks, especially in primigravida. Now, what is lightening? Lightening means there is a sense of relief of the pressure symptoms, and it is obtained due to engagement of the presenting part. And there is a frequency of the micturations reappears, and fetal movements are more pronounced. One important thing is there, and this is very important. Listen it very carefully. We have phantom pregnancy, spurious pregnancy, or false pregnancy. This is very important. So what is phantom pregnancy, spurious pregnancy, or false pregnancy, or you can say pseudosis? So it is a psychological disorder basically, where the woman has a false but firm belief that she is pregnant, although no pregnancy exists, and patient is often infertile and has an intense desire to have a baby. This is called phantom pregnancy. This is very important also. Now, next we'll talk about WHO recommend at least 4 visits. So, what are the weeks for these 4 visits? So, first visit at 16 weeks, second visit at 24 to 28 weeks, third visit at 32 weeks, and fourth, the last visit at 36 weeks. Remember this also. This is also very important. And during pregnancy, folic acid supplementation. Okay, this is very important. Why it is important? Because it prevents neural tube defects in baby. So Government of India supplies iron and folic acid tablets free of cost, and these tablets have 100 mg of iron and 500 mcg of folic acid. Remember this very carefully. 100 mg of iron and 500 mcg of folic acid. This can be asked in MCQs. So RDA of folic acid during pregnancy is total 500 mg. This is a very important line, okay? So remember this by heart. And if we talk about the dose of folic acid to treat megaloblastic anemia during pregnancy, so the dose is 1 mg per day. Okay, so these are very important lines. These are must. You should have knowledge about them. Now we'll talk about early term pregnancy, late term pregnancy, post term pregnancy, and preterm pregnancy. So this is also very important. Early term pregnancy occur at 36 to 38 weeks plus 6 days, and term pregnancy occurs at 39 to 40 weeks plus 6 days, and late pregnancy occurs at 41 to 41 weeks plus 6 days, and post-term pregnancy is more than 42 weeks. Preterm pregnancy is less than 37 weeks. This is very important. Okay, you should remember the weeks of all these pregnancies. Now next we'll talk about changes in the iron metabolism during pregnancy. So we have serum iron concentration, serum ferritin concentration, and percentage saturation, that is serum ferritin over TIBC. So they all decreases during pregnancy. And if we talk about the serum transferrin and serum total iron binding capacity, so they increases during pregnancy. These are also very important.